pleasant day to all of you. I am Lyndell Kaye and today I will be your student nurse. We all know that water is essential for life, and maintaining the correct fluid balance in our body is crucial to health. Measuring intake and output chart is one of the most basic methods of monitoring clients' health. Accurate 24-hour measurement and recording is an essential part of patient assessment. In critically ill patients, it becomes very important to accurately record intake and output for evaluation and the control of fluid balance. Accuracy in recording intake and output is vital to the overall management of certain patients groups, and it facilitates correct prescribing of interventions and subcutaneous fluids. What is really the purpose of input and output calculation? First, it ensures accurate record keeping. Second, it prevents circulatory overload. Third, it prevents dehydration. Fourth, it aids in analyzing trends in the fluid's status. And lastly, it contributes to accurate assessment record. This video contains two parts. First part will be the fluid input measurement, and the second part will be fluid output if the patient is not catheterized. Introduce yourself and provide privacy. Ensures patient's confidentiality and it helps to build rapport. Educate the patient about the fact that their fluid input is being monitored and ask them to alert you to any oral intake. And I'm going to be your nurse for today. So how are you feeling today, ma'am? Great! May I know your full name, ma'am? Okay, thank you. And how about your birthday? Ma'am, as per ordered, I will closely monitor your fluid intake. Kindly please inform me, ma'am, for all the oral intake that you are about to take. Please let me know if you have taken something or anything that will help us later on. Okay, thank you, ma'am. We need to alert the patient that they need to tell us their oral intake so that we can gain cooperation all throughout the process, so this can be noted accurately, as this information will be helpful in determining fluid imbalance. Now I'm gonna check your blood pressure. Would it be okay, ma'am? Okay, thank you. Ma'am, now I'm gonna go ahead and check your pulse. So please remain calm and relax. Okay, thank you, ma'am. Now let us check if you have any skin turgor. Thank you, ma'am, for letting me check your BP, pulse, and your skin turgor. Through the vital signs that we perform, we can check for any signs of dehydration or fluid imbalance, such as change in the blood pressure, change in the heart rate, or if there is skin turgor. Also, we need to weigh the patient daily and check for changes in urine-specific gravity and hematocrit level if the laboratory result is available. Obtain fluid balance chart, patient's name, and the date commenced. Ma'am? Okay, ma'am, I'll just put your tray back. If you need anything else, just click this call ID and I'll be right there right away. Okay, ma'am, would that be okay? Yes, again, ma'am, If you need anything else, just click this or call me through this call ID and I will be right away. Okay? Thank you, ma'am.
Obtain fluid balance chart and document the patient's name and the date commenced. To ensure chart is correctly labeled for the correct patient, allowing accurate documentation. After meals and the scheduled time throughout the day, measure and record the patient's entire fluid intake.
Okay? Okay, ma'am, I'm gonna write down your oral intake.
Be sure to include in your total all liquids consumed or administered. Foods like gelatin, custard, ice cream, popsicles, and sorbet are easy to overlook as sources of fluid. Even the fluid in ice chips must be counted as intake. Note that 100 milliliters of ice chips is equals to 50 milliliters of fluid. Any liquid, medicine the patient receives, such as antacids as well as the water or other fluid she drinks to take her pills, are counted as intake as well.
Okay, ma'am, now that we are done, so I'm gonna take this. Do you need anything else, ma'am? None? Okay, so I'm just gonna go ahead and just call me if there's any problem, ma'am. Okay?
To make sure that your measurements are accurate, record them right away. If the patient is receiving an infusion of parenteral fluid, tube feedings, total parenteral nutrition or blood components, measure and record those amounts too. Document on chart and in patient's notes to ensure accurate documentation. Determine sources of fluid output and note them on the fluid balance chart.
Okay, ma'am, I just want to let you know that if you lose control of your bowel or your bladder, just let me know and call or use this caller ID so that you will have to alert me. Okay? Would that be okay, ma'am? Great.
Explain to the patient that it is necessary to measure the urine output.
Okay, ma'am, I will be giving you this urine bottle. And here, ma'am, you will have to put your urine. Also, ma'am, inform me whenever you pass out your urine, okay? Thank you for your cooperation, ma'am.
Mark each graduated cylinder with the patient's initials and bed location, and use it only for the patient indicated. Use protective equipment for bodily fluids when handling used bottle or bedpan to prevent cross-infection. If no scales available, use a jug with volume markings. Pour urine into jug using universal precautions, noting level of urine. Take note of the color and characteristics of the drainage. Once noted, dispose of urine appropriately to prevent contamination or cross-infection. To measure urine output in a urine hat, read the amount of urine before disposing of it in the commode. Dispose your gloves and wash your hands for 15 to 30 seconds to prevent the transfer of microorganisms. Record value in fluid balance chart, adding this to the rest of the output values for the hour. Once all output has been determined, noted on chart and total hourly output calculated, subtract total output from the total input. Document all values on the chart and any other actions relating to your findings in the patient's notes to ensure accurate documentation.